Hi, now I'd like to explain to you a type 2 extension lesion, in this case ERS left or ERS right. Okay, so I've got my patient lying on the couch in the prone position and we want to identify our lesion. So in this case it will be ERS left, so extension, rotated and side bent left. So firstly we go into the iliac crest, we drop into the L4, L5 interspace. I come up here onto L4 and I'm assessing the transverse processes, and in this case we're saying that the transverse process of the L4 is rotated left, or we could describe it as closer to the skin or shallower. So in this case we now know that this is rotated and side bent left, and we want to see if it's extension or flexion. So that is the ease of motion. So if it improves in extension, it will be an extension lesion. So what I will do is I'll ask my patient, just come up on your elbows in a kind of a sphinx pose, as if you're reading a book. So in this position in extension, it actually becomes more symmetrical. And how that works is that it's a locked closed facet. So when she comes into extension, it can close, so it stays closed, and that becomes a pivot point, and the transverse process on the right side will swing around to close, and what you'll have is symmetrical transverse processes at that level. Now if I bring you into the child's pose, so if you can sit back on your heels slowly, so we bring her lumbar spine into flexion, we want to see what happens here. And in this position it actually becomes more asymmetrical. So my right thumb becomes deeper and the left thumb stays where it is, okay? So what happens here is the left can close, so when she comes into flexion the facet should open, but the left thumb, the facet there on L4 and L5 cannot open. That again becomes the pivot point, and as she flexes forward, this is the pivot point, and the right one is open, can open, so it swings around forward in an anterior direction, whilst the left one stays stuck. So that's a closed facet. So that is our explanation for a L4 extension, rotated and side bend left.